Here, I'm going to talk about the cholesterol lowering agents, or it is called anti-lipemic medication. So cholesterol lowering agents or anti-lipidic medication we use to treatment atherosclerosis. So in this picture, you can see this is the normal blood vessel and normal blood flow. When the bad cholesterol deposit in the body because of our lifestyle, sedentary lifestyle, inactivities, less physical activities, the cholesterol deposit in the blood vessel and lumen should be get narrow and blood flow will be impaired because of atherosclerotic plaque formation or artery narrowing because of this plaque. So in that condition, we need cholesterol lowering agents. So anti-lipemic medication reduce the serum level of cholesterol, triglyceride, or low density lipoprotein. When cholesterol, triglyceride, or low density lipoprotein level are elevated, the client is at the risk for develop the coronary arterial disease. So when in many cases, diet alone will not lower the blood lipid level. Therefore, we need cholesterol lowering agents or medication will be prescribed. So the most common medication we use HMG-CoA reductase inhibitors. So in these groups, particularly we use the simvastatin, atorvastatin, or lovastatin, or rosuvastatin. How this medication works? We are going to talk HMG-CoA reductase inhibitor, or other name is called statin. So you see HMG-CoA reductase inhibitors example. End of every drugs is statin, atorvastatin, fluvastatin, lovastatin, vastatin, rosuvastatin, simvastatin. So when you see the statin, it means it is HMG-CoA reductase inhibitor. First of all, I'm going to tell you how cholesterol formation. One of the submolecules synthesis inside the liver, it is called HMG-CoA. HMG-CoA, in presence of HMG-CoA, mevalonic acid convert to cholesterol. So statin is an inhibitor. They can inhibit HMG-CoA reductase enzyme. In absence of this enzyme, mevalonic acid does not convert to cholesterol, right? So as we said, when cholesterol formation, some triglyceride, some are low density lipoprotein, some are high density lipoprotein. Particularly low density lipoprotein is a bad cholesterol. They transport the cholesterol from peripheral organ to the heart and causes the blocking of arteries or formation atherosclerosis. On the other hand, HDL, high density lipoprotein, is good cholesterol because they carry out bad cholesterol from heart to the periphery and they helps to transport. They act as a scavenger. So here the list of drugs what we use as a NCLEX-CoA reductase inhibitors. Let me read it. Levovastatins is highly protein bound or should not be administered with anticoagulant. And also levovastatin should not be administered with Gamefree Brazil. So Gamefree Brazil is a bile acid sequence statin, another cholesterol lowering agent. So it is good not to use these two together. Also admin lovastatin with some fusion to the client who taking immunosuppressive medication like alemtuzumab, cyclosporine, methotrexate. So what are the common side effects of these drugs? So the common side effect, they can cause nausea, diarrhea or constipation, abdominal pain, flatulence, dizziness, headache, blur of vision, skin rash, pruritus, or elevated liver enzyme level. So these groups of drugs can cause liver damage. So when patients have a liver damage, they come to you with jaundice or right upper quadrant pain, dark urine color, or elevated liver enzyme. And also some patients present with muscle cramping. When muscle tissue break down, it is passing through the kidney and fall in stuck, which is called rhabdomyolysis. So if we see anything, we could notify healthcare provider. So nursing implication is important. Statin, particularly cholesterol lowering agents, NCLEX-CoA reductase. I'm going to talk about all of them, common information. All of them is called statin or NCLEX-CoA reductase inhibitor. These groups contraindicated in pregnancy, and statin is good not to give with the grapes fruit juice. So it is good to avoid grapefruit juice with statin. And also it is good to give at the evening because cholesterol formation occurs at the night time. So if my patient need to take NCLEX-CoA reductase or statin, we could monitor the liver function test because they can cause liver damage. And also here, intervention, monitor serum liver enzyme level, instruct the client to receive an annual eye examination because the medication can cause cataract formation. If lovastatin is not effective in lowering the lipid level after 3 months, it should be discontinued. Also, instruct the client who is taking an antilipemic medication to report any unexplained muscle pain. So if we see any muscle pain, it is good to inform the healthcare provider, right? So particularly for statin, I want to tell you some key point for NCLEX board. It is good to administer all of these drugs with evening food or meal because cholesterol is synthesized at the night time. And also it is good to check the liver function test or CK level, contraindications of pregnancy, and avoid the grapefruit juice. Another common drugs we use, this is called bile sequestrant, bile acid sequestrant. So in these groups, basically the group of drugs is here, Polystyramine or ezetimibe, Gamefree Brazil, and nicotinic acid. So bile sequestrant with acid in the intestine, bile bind with acid in intestine, which prevent reabsorption of cholesterol and should not be used as the only therapy in the client with elevated triglyceride level because they may raise triglyceride level. The common side and adverse effects are they can cause constipation, they can cause gastrointestinal disturbance like heartburn, nausea, blanching, or bloating. This is the common side or adverse effect for bile acid sequestrant. Now, let me talk about the polystyramine. So, polystyramine is one of the drugs in bile acid sequestrant. It comes in a powder form that must be mixed thoroughly in the juice or water before admin. Monitor the client for early sign of peptic ulcer such as nausea and abdominal discomfort, followed by abdominal pain and distension. Instruct the client that the medication must be taken with and followed by sufficient fluid. It would be easily expelled out from the body. Other drugs is called Gamefree Brazil. So Gamefree Brazil is also bile acid sequestrant. It should not be taken with anticoagulant because they compete with protein side. So bile acid sequestrant, particularly Gamefree Brazil, is good not to take with anticoagulant. The anticoagulant dose should be reduced during cholesterol-lowering agents therapy, and INR should be monitored closely. And do not admit Gamefree Brazil with HMG-CoA reductase inhibitor like simvastatin, atorvastatin, lovastatin, or rosuvastatin, not to give together. Why? Because it increases the risk of myositis, myalgias, or rhabdomyolysis, means muscle pain or muscle breakdown. And when muscle tissue break down, they try to passing through the kidney and fall in stuck, and it causes the renal failure, acute kidney shutdown. Fish oil supplement have been associated with decreased risk for cardiovascular heart disease. The plant's stenol or sterol ester has been associated with reducing cholesterol level. So omega-3, omega-6 or fish oil is good for your heart. They reduce the bad cholesterol. Here, some bile acid sequenced medication list. The first one here, it is Polystyramine, then Polystyramine. So let me tell something about this group. So the key point about Polystyramine, this is increase the dietary fiber and fluid. So if your patient take this one, tell your patient to increase dietary fiber and fluid. Why? Because they can cause constipation. They can cause flatulence or bad taste in the mouth. Also, cholestyramine can cause same thing. And now, also it is important, it is good to take with food and full glass of water. These two drugs interfere with absorption of fat-soluble vitamin and also oral contraceptive pills interfere. Another group is here is called ezetimibe. Ezetimibe is a bile acid sequencer. They can cause, as a side effect, abdominal pain, back pain, diarrhea, joint pain, or liver damage. So if ezetimibe can cause liver damage, it is good to check the liver function test, and it is good to check CK level. So another one is called Gamefree Brazil. So Gamefree Brazil is a bile acid sequencing. They increase the good cholesterol, means they increase the HDL. Gamefree Brazil can cause headache, constipation, vertigo, rash, nausea, and vomiting, and sometimes fatigue and diarrhea. What we need to know for Gamefree Brazil, what are the key points? It is good, give 30 minutes before breakfast and dinner. And also we have to monitor liver function test and CK level. Another group medication is called nicotinic acid or niacin. This is the onion. So onion is the source of niacin. it reduces your cholesterol. So niacin, other name is called vitamin B3. So if my patient take nicotinic acid or niacin, it is good to check blood glucose level and also monitor liver function test. And nicotinic acid has a common side effect. They can cause flushing or hot flash, nausea, indigestion, gas formation, or diarrhea. So now I'm going to talk about the intervention or nursing implication for all cholesterol lowering agents. It is good to monitor vital sign, also monitor liver function level, because most of cholesterol lowering agents can cause liver damage. Monitor serum cholesterol and triglyceride level. Instruct the client to restrict intake of fat, cholesterol, carbohydrate, and alcohol. So, okay, it is good to take restricted intake of fat, cholesterol, because it is a source of triglyceride or LDL. But why carbohydrate? So if I take too much carbohydrate and I do not do physical exercise, sedentary lifestyle, the excess carbohydrate converted to the fat. So it is also important restricted carbohydrate. Instruct the client to follow an exercise program. Instruct the client that it will take the 7 weeks before the lipid level decline. So these groups of drugs take time to start work. Instruct the client to have an annual eye exam and report any change in the vision. Instruct the client with diabetic mellitus who is taking Gamefree Brazil or monitor the blood glucose level regularly. Instruct the client to increase the fluid intake. What next? So note that nicotinic acid has few side and adverse effects that I told you, including GI disturbance like vomiting and diarrhea, flushing of the skin or hot flush, elevated liver enzyme level, hyperglycemia, and hyperuremia. So if your patient has a diabetic, it is important to educate to check the blood sugar level or adjust the insulin. If my patient has a gout, if they took the niacin, it is important to check uric acid level because their gouty attack would increase or liver enzyme level need to check. Instruct the client that aspirin or non-steroidal anti-inflammatory drugs takes 30 minutes before and may assist in reducing the side effect of cutaneous flushing from nicotinic acid. Also instruct the client to take nicotinic acid with meal to reduce the gastrointestinal discomfort. This is the basic information about the cholesterol lowering agents, what we use to treat the arteriosclerosis.